In tonight's special report, October is National Bullying Prevention Month, and studies are showing that bullying may be on the rise. That can lead to mental health issues among kids, which could become destructive.
NBC Local 33's Jacquelyn Kisic spoke to experts on what you can do to help.
Bullying is a repeated pattern of intentional harm to someone.
Over 20% of children in the United States report bullying. That's according to the National Center of Educational Statistics, finding it's most common among 12 to 18-year-olds. These students report being victims of verbal, physical, social, and cyberbullying.
When we think about the dynamics of bullying, it really is all about power.
Dr. Stephanie Eberts is a well-known counselor at Louisiana State University. She's been studying patterns in children's behavior when it comes to bullying.
They're trying to figure out who they are, and they often do that by trying to see who they are like and who they are not like.
Eberts says what students don't like, they tend to take out on kids who may be different compared to them.
Racism, sexism, even economic privilege can be used against kids.
Dr. Eberts found when kids find a loophole in those categories, they tend to assert power over their victims.
The idea of a child wanting to assert power, they will use anything that could potentially put that child in a position of weakness or vulnerability.
According to the Centers for Disease Control, bullied students are more likely to experience low self-esteem and isolation. Research has also shown that bullying affects mental health and can be tied to suicidal thoughts. Eberts suggests parents to look for certain behaviors if they think their child may be a victim.
Avoidance of school, avoidance of friends, avoidance of social activities. When you start to see those sorts of things, that might be a red flag.
The national campaign, If You See Something, Say Something, comes into focus if there's a problem. The president of the Autism Society, Beryl Aber, works daily with children on the autism spectrum. She says 20% of children without disabilities are being bullied, but claims it's higher on the spectrum.
Individuals with autism, it's probably twice that much.
Aber says she teaches them how to be face-to-face with a bully.
Some way where you find within yourself your voice, your strength, your superpower. A lot of kids on the spectrum will say, that's my superpower.
And when it comes to any child that's being bullied, she has some advice.
It's good to have that voice. And what we would like to see happen is for them to have more and more of a voice.
According to EBR school board member Darius Lannis, he is well aware of the growing number of students being bullied.
We've known it has grown. And because it has grown, we know we have to take some more direct approaches and measures.
Louisiana legislators decide to pass an anti-bullying law this past legislative session. And when school bullying occurs inside a school, it is now considered harassment. According to federal laws, the schools have legal obligations to investigate. This is in hopes of slowing down any school bullying statistics from continuing to rise.
We have changed several of our policies, and we want to continue to make sure that every child feels safe and protected while they're inside of our schools. But even when they're at home, we want to make sure that those things also carry over.
One of those policies help provide resources to the child known as the bully in some cases.
When it comes to our students, it has to be an ecosystem where everybody works together so we can give true wraparound services for that child.
The school system is now working on developing new tools in hopes of finding ways to create a new mindset and ultimately a healthy school environment. Reporting Jacquelyn Kisic, NBC Local 33 News.